Tobradex is an antibiotic and a steroid combined into one eye drop. This drop should be applied to your sty about 4 times per day. If it's on the outside of your eyelid, then it should be applied directly to your sty and not into your eye. You can either do this with your clean, dry hands or with a Q-tip. If the sty is on the inside of your eyelid, though, then you can put the drop in your eye. The benefit to using Tobradex is that it will hopefully make your sty resolve a little bit faster, though this is an off-label use of this medication. Some things that you should understand before using Tobradex is that, as well as all other ophthalmic steroids, while it has benefits, it also has some risks. The main risks that you should know about are that it could potentially decrease your best corrected visual acuity. Specific side effects to steroids include cataracts and glaucoma or increasing the intraocular pressure. Other risks that I wouldn't expect but could happen include bacterial infections, viral reactivations, fungal infections, as well as other side effects on the cornea or the optic nerve. If you're using Tobradex for longer than 10 days, then you need to make sure that you're seen by an ophthalmologist to have your intraocular pressure monitored.